Okay, it's time for Mr. Howe's morning meds, and then I'm gonna get him ready for breakfast.
Okay, great.
Okay. Good morning, Mr. Howe. How are you? I have your morning meds.
Caring for someone living with Parkinson's disease, whether in an assisted living center or a nursing home, can be a challenging task. While this is a complex disease, knowing what it may look like will give you the confidence and knowledge needed to provide excellent care for someone living with Parkinson's. Let's begin by answering the fundamental question: what is Parkinson's disease? Parkinson's disease is a degenerative disease of the brain, meaning that parts of the brain are slowly dying, leading to a variety of symptoms. When diagnosing Parkinson's, doctors look for two of the four most common symptoms: a resting tremor, stiffness, slowness of movement, and gait and balance issues. But keep in mind, no two people living with this disease look the same. Parkinson's disease progresses slowly over time. The average age of someone diagnosed with it is 58, which means a person can live with the disease for 20 to 25 years. Although not as common, early onset Parkinson's can be diagnosed in people as young as 20 years old. Scientists are actively studying Parkinson's in an effort to develop new treatments to significantly improve the lives of people living with this disease. Research reveals that Parkinson's is caused by a loss of dopamine in the brain. Dopamine is the chemical messenger responsible for transmitting signals which enables us to move our body in a coordinated manner. What it comes down to is when we don't have enough dopamine, we don't move well. In addition to reduced levels of dopamine, there are other chemicals in the brain that are affected in Parkinson's, leading to changes in behavior, emotion, and thinking ability. Since no two residents who have the disease display the same symptoms, let's take a deeper dive into the variety of symptoms you may encounter as you tend to a person living with Parkinson's. What are the symptoms of Parkinson's disease? Symptoms are divided into two categories: motor symptoms and non-motor symptoms. Motor symptoms are those symptoms related to movement. For example, an individual with Parkinson's will shake or tremor at rest. These tremors can affect their ability to dress, eat, or drink from a cup, but usually they go away during such activities. Parkinson's residents usually move quite slowly, which is called bradykinesia, or sometimes, no matter how much they try, they can't move at all. That is known as akinesia. Many people living with this disease walk with a shuffling gait and stooped shoulders. You may also notice that they don't swing their arms when they walk. Individuals with Parkinson's may also have balance issues. It can happen in an instant. A resident is moving slowly or even standing in place, and without warning, they fall. Sometimes they fall backwards, even though they are using a walker. Awareness of this instability while caring for someone can prevent injuries. You may notice that a resident's handwriting is small and becomes tinier as they write. This is called micrographia and is commonly associated with neurodegenerative disorders like Parkinson's disease. Talking in a very quiet voice is another motor symptom of this disease. It's called hypophonia, meaning soft speech. Asking a resident to speak up may be something they're unable to do due to the nature of their disease. You may have to get close and lean in when your resident speaks in order to hear what they're saying. People often misinterpret the lack of facial expression as disinterest when talking to a person who has Parkinson's disease. The masked face, as it's called, is common. It's good to remember that a person with Parkinson's may have a flat affect or no expression at all, but it doesn't mean they're not listening or don't care. Now let's focus on non-motor symptoms, which are those symptoms not related to movement. Sometimes, even before someone is diagnosed by their doctor, they will experience depression, constipation, loss of smell, and sleep problems such as punching, kicking, or screaming at night. Other non-motor symptoms include impotence, urinary problems causing a lack of control, whether urgency, the need to run to the bathroom, frequency, going all of the time, or incontinence, not making it there in time. Low blood pressure, when changing from sitting to standing, called orthostatic hypotension, can cause falls. Excessive sweating or feeling too cold. Sensory disturbances such as tingling, burning, or painful sensations, problems swallowing, pain, and fatigue. You can see from this list each person living with Parkinson's may experience a unique set of symptoms. In fact, movement disorder specialists say if you've met one person with Parkinson's, you've met one person with Parkinson's. There is a lot of research being done to bring people with Parkinson's new and improved treatments, and perhaps one day even develop a cure for this disease. But for now, there is no cure. So, what is the treatment for Parkinson's disease? As a caregiver in an extended care facility, you may be responsible for giving medication to Parkinson's residents. The medicines given act as a replacement for the lost dopamine-producing cells in the brain, which we talked about earlier. The brand name drug Sinemet is a combination of the drugs levodopa and carbidopa. It's one of the most effective and best tolerated medicines taken to control the motor symptoms of Parkinson's disease. Each type of medication and dosage varies from person to person. It's very important to remember that the medication wears off and the next dose must be given on time to help someone manage their disease. Knowing what Parkinson's disease is, recognizing both the motor and non-motor symptoms, and understanding the importance of the right medications being given at the right time will enable you to provide high-quality care. Being patient and attentive when caring for people with Parkinson's can make all of the difference in someone's day and dramatically improve the quality of life for those people living with Parkinson's disease.